I would like to talk a little bit about the coronary artery disease, cardiovascular disease, and risk factors in the Mena region. As we know, cardiovascular disease is the #1 killer in the Mena region. Our patients are much younger when they have coronary artery disease than the patients that have coronary artery disease in the West. They're usually 10 to 15 years younger than the patients in the West. The mean age of coronary artery disease patient in the Gulf is around 50 years. Now, what is the reason for all this increased burden of cardiovascular disease, which is expected to increase over the next 20 years? Well, the main reason is the prevalence of numerous risk factors. The first risk factor obviously is dyslipidemia, and this is quite common in the Mena region, up to 50% in the Gulf. Other risk factors, of course, are diabetes, obesity, smoking, hypertension, and inactivity. All these risk factors have caused an increase in the number of cardiovascular diseases in the region. And currently these risk factors are not controlled, and therefore we expect coronary artery disease to increase. Over the last 20 years, there's been a lot of research that has been done in the Mena region with regards to cardiovascular disease and risk factors, and we've started to learn more about cardiovascular disease in the region. However, most of the data is still not enough. We need to do a lot more research about the patients in this region and why patients here get coronary artery disease early in life. One of the things that we have established here in the OSLA with the IAS is the annual grant. This allows young investigators to apply for this grant, and this is supposed to stimulate these young researchers to learn new techniques or to do research in atherosclerosis and coronary artery disease. And we hope that in the future we get more applications for this grant. Thank you.